Is Dr. Helen Lavretsky, Professor of Psychiatry at the Semel Institute at UCLA. She will be speaking on Kirtan Kriya on stress family caregivers for people with dementia. She will be explaining the effects on mental health, cognition, telomerase, gene expression, and brain metabolism.
It's a pleasure to be here, and I'm glad to be here. Thank you to the organizers for inviting me, and thank you to Satbir who introduced all the topics I'm going to talk about. I don't have to cover the basics. I'm a geriatric psychiatrist, so I work with older adults who are depressed, have dementia, and their caregivers. And I'll be presenting a study of Kirtan Kriya in caregivers who are very stressed. Nope. Oh, okay. So after I read the prospect for the conference, I realized that one of the focuses of attention is on aging, and not something I do every day. Aging research and the research into mind-body techniques with respect to aging is to enhance physical and mental health and manage pain, symptoms, disabilities, sleep, impact on health, and ultimately prevention of disease of aging. So as we age, we experience more stress, simply because we're older, and over the years we are exposed to more stressors, and that stems from exposure to trauma and maybe abuse in some instances in childhood, and then major life events of the course of life, environmental stressors, losses. But how we perceive stress is very different based on our genetics, our predisposition, our experiences, life experiences, and that goes on to develop pathological responses to stress with increased inflammation and eventually development of physical and mental illnesses. And I won't cover it in depth, but basically central nervous system, endocrine system, and immune system interact in response to stress, and the central system, especially autonomic nervous system, are responsible for regulation of stress response. And some of this is adaptive evolutional, so it's good for us to avoid stressors or respond appropriately, but over the course of chronic stress exposure, we tend to develop multiple illnesses. And so mind-body interventions like yoga and meditation can help alleviate some of the stress, pathological stress response or pathological effects of stress. In terms of aging, the major focuses of applications of mind-body techniques are for insomnia, mood, and cognition in older adults. Research in the US is extremely limited. Again, money is a major consideration. But most evidence exists for exercise, herbal therapy, the use of fish oil, acupuncture, and relaxation therapies. And again, public awareness and interest in meditative techniques is increasing. And so lay press is full of various articles on the topic, and research is lagging behind, unfortunately. So the public is fascinated by the fact that you can control your responses to stress, while there's a genuine inability of an individual to control what's going outside of yourself. So I believe the public support will result in improvement in terms of funding in this area. I choose to study informal dementia caregivers because they're normal people, only very, very, very stressed. And as I was preparing for this conference, I realized that culturally, probably there's a difference in how an Indian caregiver would perceive having to take care of their parents or their spouses versus U.S. caregiver who perceives this as an imposed stress, where in India it's expected to take care of your loved ones. So, but here it's a tremendous stressor, and caregivers tend to spend 24/7 basically taking care of someone else, and they frequently feel ambivalent and robbed of their own lives. they're at high risk for development of major depressive disorder, about 50% incidence and prevalence, which means at any given time 50% of caregivers have depression versus 50% don't. And I'm actually interested in those who don't have depression because they have some resilience factors protecting them from developing depression. At this point, we have over 5 million patients with dementia in the US, and as many caregivers taking care of them. Most of the caregivers are older and women, and the majority of them take care of their loved ones for over 5 years, which is a chronic stress exposure model that I use to study effects of stress and effects of meditation on stress response. I have a little clip from the interview that I had. Can you start it? Let's see how it goes. So the Kirtan Kriya, for those of you who are not familiar with this, the clip will show some of the practice. None of the caregivers knew anything about Kirtan Kriya or yoga practice, maybe some yoga practice, but not that this style. Is it loud? You don't hear me.
Yeah.
Maybe, you know, don't worry about it. I'll explain. Yeah. So the mantra that they're using is Satanama. And it's an only 12-minute practice because, for the most part, it's because caregivers can't leave the house and they can't go to a formal yoga practice like an hour class. And so the other thing is their care recipients or their relatives with dementia are following them around the house. They can't leave. So 12-minute practice, some of them have to lock themselves in the room or in the bathroom to just have this experience. And I asked them to practice it mostly in the morning, but some of them preferred at night because they found that it actually improves their sleep. Can you now stop it?
Okay, stop.
Okay. Yes, thank you. Now enlarge the. Okay. So the objectives of the study was to compare physiological, cognitive, neurobiological effects of meditation practice and relaxation in very stressed and mildly depressed caregivers. They practiced 12 minutes of Kirtan Kriya a day for 8 weeks. And again, the attraction for me to use caregiver model is because we could study resilience and risk factors for stress response and for depression. And it allows various explorations of genetics, gene environment, and stress vulnerability models in terms of developing major depressive disorder. And eventually developing interventions that prevent depression. Negative aspects of stress is development of physical and mental diseases and higher use of psychotropic medications. Positive influence, some caregivers experience some positive influence, comes from increased emotional support from family and friends, increased self-confidence and a sense of mastery, and again, 50% are not depressed. So far, there have been only 2 pilot studies of meditation in caregivers. Most of the interventions for caregivers are skill-based, providing social support, psychoeducation, skills training, but nothing is addressing their own response to stress. Meditation is well-positioned to do so. And so we kind of dissect elements of stress response by measuring severity of stress. and that's patient's characteristic, the stage of dementia, behavioral problems they might have, and caregivers' perception of stress, like losses and how they perceive stress. Innate characteristics such as age, gender, ethnicity, genetics, and personality and affective styles that determine their predisposition to developing depression. And then we use neuroimaging as a intermediate measures of physiological response, and then the phenotypes of depression, present or absent, and resilience to stress. So we collected 39 stressed caregivers who never had any kind of significant yoga practice. So they were yoga naive and certainly Kirtan Kriya naive. And they practiced it for 12 minutes a day with the tape. We provided them with the standard tape. And control group was instructed to go to a quiet place, close their eyes, and listen to instrumental music without words. And we measured distress, depressive symptoms, anxiety, perceived burden of stress, cytokines, cortisol levels, catecholamines, cognition, PET scans, fMRI in a subsample, but also NF-kappa-B, which is a measure of inflammation, telomerase, which is a proxy of biological age, biomarker, and gene expression. So I practice Kundalini Yoga, and I'm trained in Kundalini Yoga as taught by Yogi Bhajan, and this practice was also extracted from this tradition. So it goes for 11 minutes. They are asked to chant Satanama for 2 minutes, then silently whisper for 2 minutes, 3 minutes silent chanting inside, then whisper, and then out loud for 2 minutes each. And there's a melodic tune to the chant Satanama, as I was trying to show. They're also asked to focus their attention and imagine light coming through to the top of the head and coming through the brow point, focus of attention. And they're pressing fingers. And these elements actually are important when I present fMRI results, because they train certain parts of the brain to perform this task over a period of 8 weeks. And that's what we see on some of the neuroimaging results. So out of 39 subjects who completed the study, 23 were in meditation group, and 16 were in relaxation group. And they did not differ by age, education, the duration of depression and stress, and it's a long, prolonged, 45 versus 40 months. Years of caregiving, almost 5 years in each group. Hours per week, a lot of time. And then CRS is medical burden. They had some illnesses. They were middle-aged to older adults, so they had some illnesses. And vascular risk factors, and depression here was in very mild to moderate range. We couldn't have really depressed, otherwise we would have to give them medications. Depression scores improved over time in both groups, and a relaxation group actually did pretty well on psychological measures. And that's because these people are very stressed. They have absolutely no time to themselves and no self-concept of allowing themselves to have 12 minutes to themselves to just quiet down and be silent. So that was a powerful intervention, in fact. But the meditation group improved in depression measures much better than statistically significant, the difference between the groups. Resilience as well, both groups did pretty well, but the meditation group did a little bit better. When it comes to cognition, to my surprise, and this is the second study that I do with mind-body techniques, and I find it in each of the studies I found the same results. Cognition really improves with meditation. And this is a mini mental state examination score, which is a global measure of cognition, especially important in older caregivers. Many of them complain of memory effects of stress. This is executive function test, and again, meditation did better with this test, in this test. And NF-kappa-B is a nuclear substance in the nucleus of the cell, in each cell. that is responsible for inflammatory pathway signaling. So it switches on and off inflammatory processes in the body. And it's associated with cancer and any other inflammatory diseases like arthritis and many other illnesses. And so the meditation group showed downregulation in NF-κB expression, so it improved or decreased inflammation in the body, and in relaxation group it increased. Telomerase, as I said, is a biomarker for biological aging, and telomeres are a protected DNA sequence. So we're now talking about cellular level. DNA sequence at the ends of the chromosome is a marker of longevity, cellular longevity, linking stress and disease, and predictor of long-term cellular viability. And again, with meditation, the more telomerase is better, because they are the telomerase is responsible for the viability of telomeres. So the more telomerase is better. So it improved level of telomerase activity with meditation over the course of 8 weeks, even with 12 minutes a day, versus relaxation. When I started the study, the telomeres researchers did not know how long it would take to show the change over time, so I'm telling you. So it's one of the first studies to show that you can see a significant effect over the course of 8 weeks. And then we did microarray analysis and gene expression, and found two trends. Antiviral immunity improved, was upregulated, and the inflammatory pathways were suppressed or downregulated, which supports NF-κB finding. And this just shows the trends. So promoter-based bioinformatic analysis is a special technique, a statistical technique to analyze multiple genes, and it implicated reduced NF-κB signaling and increased activity of the interferon response factor 1. So the next, we put 9 caregivers in the PET scanner before and after. So PET scan can show chronic effect of meditation very well, or any interventions, but it's not good for showing acute effects of intervention. That's why in the end we asked 9 caregivers to do meditation in the fMRI scan. But this is a chronic effect of meditation, and the change and the difference between the group was an inferior frontal cortex on both sides, but I think it's on the right inferior frontal cortex more significantly. And that area has to do with alternating movements. Like I said, they were chanting, they were tapping fingers, and they were visualizing light. So inferior frontal is responsible for complex decisions or alternating sequences. So this was like a brain fitness effect from meditation. At least that's how I interpreted it. And another area that showed intergroup differences was visual associative cortex, and it has to do with visualization effect. When I saw the results, that was my immediate interpretation, that the meditation, it actually does matter what is involved in meditation, the components, because that will be reflected in the brain activation or metabolic changes. The blood flow and metabolism in the brain was decreased, which means that in these areas, brain areas were more efficient. So that's what we see in exercise studies, that metabolism and blood flow are decreased, and the brain becomes more efficient in producing this stuff. So then, this is an fMRI paradigm, and it's very interesting for Satbir's sake. The paradigm is very interesting. So we asked them to first rest and ask them to have their mind silent and wander. So it imitates a default mode network. Then we asked them to do Kirtan Kriya for 5 minutes, abbreviated version. Then we sequestered elements, only tapping, only chanting, and only visualizing, to see if the total meditation effect was sum greater or equal to the sum of the elements. And So meditation was greater than relaxation in terms of brain activation in right orbitofrontal cortex and right inferior temporal gyrus, and the relaxation over meditation in left thalamus, which is more internal. The TAP, chant, and visualization produced expected results. They activated areas of the brain that are responsible for this test, like left occipital cortex for visualization and TAP in motor area. And then we combined the two, and the meditation was still greater than some of the elements in several areas of the brain that are highlighted in red. Also, independent component analysis then looked at group changes, and for relaxation, just visually, it's a different pattern. So relaxation was very similar to default mode network described, but the meditation was more active, and again, inferior frontal areas were more activated. So it's a very interesting study to me. Very promising results for future studies of meditation for caregivers. Acceptability of mind-body techniques is well received in caregivers who don't like to use medications, and also among minorities that are more spiritual in nature. They like the idea of meditation. So my perception is I'm a Western trained physician, so individualized approach and the use of Western and Eastern techniques and measures of outcome are necessary to discern the benefit of the intervention in meditation and yoga. But what is the ideal design is something that we are all struggling with. Thank you.